Okay. Wait, let me see. Do you have any question before I start? So you have like 10 more days or something for your assignment. Please work on it. Do well on it. Okay. Some of you probably need the marks for your carry marks. Okay. They will help you. Okay. Some of you that didn't do well in test 1 or test 2, you may need this mark to cover your things. Okay. Some of you ask me some questions. For example, for the short notes, you just have to like literally put everything. But short notes doesn't mean you have writing an essay or something. Short note means like you create a notes for you to study. For me, I do have a notes that I fold a paper into one piece or two pieces like this. I wrote a very small letters with short. Oh, I do some mind maps. Okay, to make me to make it a lot easier for me to study later. But it should have all the information needed. Okay, not too short. Short is like compact but informative. Okay. Okay. Let's get started. If you don't have any question, let's get started with the question. With the Okay, today's lecture, my lecture is almost finished actually. Probably this one and then next one should be the last one or something. And then your test 2 is coming soon. Your final coming soon in about 1 month's time. Okay, and the project we talk over after this. Okay. Okay, today's lecture we're going to cover a little bit of toxicities and poisoning and some miscellaneous disease. I'm still adding some miscellaneous disease, the important one that I think should be in the lecture, but it's not included. But that one I'll do a little bit at the end. What we're gonna do today is like aflatoxicosis, botulism, toxic side syndrome, and sulfur drugs poisoning. But aflatoxicosis, we have covered this before. Botulism also covered this before. Maybe we covered a little bit of toxic fat poisoning and sulfur drugs poisoning. When it comes to toxic fat poisoning, I wouldn't say it's important disease. You will never see any in your life or so, but it's something that you may want to know. Okay. Okay. Is due to dioxin. It's a toxic found in saponified fat and a toxic substance stored in body fat. Dioxin can damage vascular endothelium, causing vascular leakage and extensive movement of fluids into the body cavities and subcutaneous tissue. It is mainly found as a contaminant in feed. It had caused quite an issue back then in Europe because of dioxin contaminant in chicken feeds. Okay. It could damage epithelium of parenchymal organs and degeneration of heart and skeletal muscles. The lesions will look quite similar as right-sided heart failure. Okay, one of the famous cause of dioxin toxicity or dioxin poisoning was Viktor Shushenkov. He was the third president of Ukraine, if I'm not mistaken, or something. During one of these election campaign or something, there is an assassination attempt. Okay, so they poison him. There's one group that poison him with dioxin. It caused disfigurement of his face. You can see a good-looking guy and then become like this. But he survived. He survived. It's just one of quite famous dioxin toxic poisoning case. Okay. Clinical signs related to it, you see marked depression in chicks 2 to 6 weeks old. There was some sign of weakness and ataxia, stunting, respiratory distress, pot belly edema. This like related to that. So look similar with the right-sided heart failure, and mortality is high. Depends on the dose. The post-mortem lesion is due. You'll see accumulation of clear straw-colored fluid distended abdomen and pericardial sac, subcutaneous edema, liver looks swollen and coated with fibrins, and the kidneys will look like glomerular nephritis. Will show signs of glomerular nephritis. And the lesion somehow sort of look like salt toxicity as well. The diagnosis, feeding trials. You feed a normal chicken with the feed that is given to the chicken that was suspected and see they develop the similar clinical signs. Okay, you just collect the feeds and then feed them with to the healthy chicken. So they do some That's what we always do for toxicity kind of case also. When it comes to, for example, botulism, all those things is the same thing. Okay, so that one is just a bit because it's not that important. Next one is sulfur drugs poisoning. This one happened quite a number of times because of mixture of the sulfonamides, one of the ingredients for treatment of coccidiosis. Toxic level is close to therapeutic level, so it's quite easy to overdose. Okay, the therapeutic level is that a little bit is already toxic. Okay, so it's quite easy to overdose, especially if you didn't mix the drugs well into the feed or something, accumulate in one part of the feed, and then you can see some cases. Detrimental effect on hematopoietic and immune system. Sulfonamide is difficult to mix evenly in the feed. Okay, that's what I mentioned earlier. The effects, you'll see that hemorrhagic syndrome, bloody dyscrasia, bone marrow depression, thrombocytopenia, depression of lymphoid system and immune function, and also the epithelium degeneration in liver and tissue. Clinical signs that you'll observe is depression and pale. Frequently, the chicken appear underweight. In adults, it decreases in egg production and shell quality, and brown eggs may be depigmented or become white. Postmortem lesion, you'll see hemorrhages on the skin, muscles, and internal organs. So basically, this kind of toxicity causes generalized hemorrhages. Hemorrhages may be present in the comb, eyelid, face, wattle, anterior chamber of the eyes, musculature of the breast, and thigh. The normal dark red colored bone marrow, okay, slowly turned pink and yellow over time, was replaced because of this toxicity, because damage to the hematopoietic system. The intestine will show signs of petechial and achromatic hemorrhages, okay, on the intestine. Is some of the general signs. Basically, the chicken will show sign of like hemorrhages everywhere. Hemorrhages everywhere, swollen and edema. If you open some of the area of the chicken, it's just blood oozing out because of the toxicity. Postmortem lesions, you also can see ulcers at the proventricular or gizzard junction. Liver appear pale, swollen, icteric, petechial, or focal necrosis. Spleen looks enlarged, hemorrhagic infarcts and gray nodular areas. Paintbrush hemorrhages in myocardium. And thymus and bursa of fabrices will look small. This one of the disease that can cause like sort of like immunosuppressive effects. Prevention, treatment, there is no prevention. You just have to make sure that you mix it well. Okay. Precaution and control. Yeah, okay. You just mix it well, the dosage and continuous medication instead of like for like one bunch of treatments. Okay. So you have to make sure you do it well. Even in Malaysia, you rarely see of this case because probably the feed mill company are doing the mixings quite well. But if you are doing treatment for coccidiosis or something using sulfonamides, high chances that you can see some of the signs if you exceed the dose. Okay, just a little bit of last one, miscellaneous diseases. Some of the important diseases cannot be classified in others, all those things, but you will see once in a while. Ranting and stunting syndrome, also known as malabsorption syndrome, infectious stunting syndrome, broiler ranting syndrome, pale bird syndrome, helicopter wing disease. This is actually a disease that would say you cannot classify really on what causes it, but they just stunted. Okay, because there's a lot of like etiology that can cause it. Reovirus, adenovirus, rotavirus, all these things. Okay, astrovirus. These are some of the common one, the most common. So when you have say ranting syndrome, you just check. Okay, some of them positive for reovirus, astrovirus, rotavirus, but we cannot like really determine. Okay, is it the cause it the main cause of it, or is related to other things? So it's like that's why it's called ranting and stunting syndrome. Can be exacerbated by Campylobacter, spirochetes, molds, and others. Predisposing factors are usually poor hygiene, poor sanitation, or poor biosecurity, cold, droughts, and overcrowding. So the etiology is like undetermined, but you'll see a lot of like birds didn't grow well. The clinical signs, birds affected within first 2 weeks of life. You see some signs of diarrhea and nervousness, growth retardation. This is chicken of the same age. You can see the difference. Okay, this is the retarded one, the stunted one. You'll see some sign of little eating and excessive drinking, depressed weight gain, decrease in feed consumption, and increase in FCR. Poor feather development, primary wing feathers. Some show sign of helicopter wing in this kind of ranting and stunting syndrome. Usually they relate it with urovirus infections or astrovirus infections. Ruffled feathers and soft bones. You'll also see crusted materials at the commissure of the beaks due to little eating. Distended GIT contains poorly digested foods, gas, and fluid. Loss of tone of intestinal tract. Dilated ceca with foul-smelling frothy contents. Pancreas looks partially or completely atrophied. And bone abnormalities there appears some signs of osteodystrophic and swelling of the epiphysis. So basically, this is what they look. One of the prominent signs of this thing it didn't mention. Okay, see. Is atrophy of the pancreas. How do you know the pancreas is atrophied? Usually the appearance like it should look straight like that. When the pancreas atrophied, usually the duodenum become curled. Okay, it's like so curled because the pancreas is like in the middle, become atrophied, it curled the pancreas. Okay, and a pale pancreas. Diagnosis, you just assume based on clinical sign, postmortem lesions. Some do histology. In histology, you will see sign of the intestine or pancreas. There's some atrophy in the pancreas. Even in the intestine, the cilia doesn't look good. You can also do feeding trials, okay, if you want to suspect if it's in the feed or something. But diagnosis is quite difficult because you cannot really pinpoint what causes it. You just know, okay, there is the bird suffering from ranting and stunting syndrome, but that's about it. Because if you do isolation or something, you cannot really like say, oh, this is because of this virus or something, because that virus can cause other things. Because a real virus, astrovirus, ranting and stunting syndrome is just the side effect of it. There is no treatment to this. There's no treatment to this. Okay. Next one is histomoniasis. Histomoniasis is quite common. I've seen it quite a number of times in Malaysia, in Turkey population basically. Some of our farmers, they kept turkeys, especially the backyard farmers. They have turkeys as pets or just to have some variety at the farm. It's a parasitic disorder of ceca in the liver, characterized by necrotic foci in liver and ulceration of the ceca. Other names as infectious enterohepatitis or blackhead. The etiology is Histomonas meleagridis, is the protozoa. Okay, but it's carried by Heterarchis gallinarum. Okay, if you have this disease, usually you check the intestine, look for the worms. Okay, because it requires Heterarchis gallinarum as the host, intermediate host. Eggs of Heteromonas survive in sickle worms and the earthworms. The incubation period is about 7 to 12 days. So, like this. Direct fecal oral within the flock, so they just eat it and then another guy eat it, or it goes into the on the floor, okay? And then the earthworm eating it, and then the chicken or the turkey eats the earthworm, so they get infected. So there's indirect transport, the sickle worm, ova, plus histomonas in the earthworms, also possible. So it's either through the earthworm or they just direct the horizontal transmission through fecal oral route. Okay, these are the worms inside here. I don't think some of these small worms, see small worms. Clinical signs, usually you should see loss of appetite, anorexia, semi-solid sulfate-colored, brilliant color feces, drowsiness and drooping of the wings, so just sign of weakness. Walking with tilted gait and closed eyes, head down close to body or tuck under wings. Okay, they look like this. So you can see here, the wing droop, the head drops in those chicken with affected with histomoniasis. For postmortem lesion, The cecal lesion, the cecal walls appear thickened and hyperemic. Serous and hemorrhagic exudate from mucosa, filled lumen of ceca, distended the walls with caseous or chisicos. You'll see some of ulceration, perforation, and peritonitis. For liver lesions, you'll see circular depressed area of necrosis circumscribed by a raised vein. This is one of the pathognomonic lesions for histomoniasis. I'll show you after this. The liver may appear enlarged and discolored. In the lung, kidney, spleen, and mesentery is white rounded area of the necrosis. This is the appearance of histomoniasis on the liver. It looks like they have a here circular depressed area of necrosis circumscribed by a raised ring. Okay, they look, okay, this one is quite severe. That's all this. This one, it look like this. It's like a ring here, okay, and then it's dark in the middle. Okay, it's like a ring, white ring. It's like what do you call it? Gerhana. Okay, this is how they look like. So whenever farmers send me picture of the livers look like this, then I know what causes it already. Okay, they look like this. Okay, circumscribe all the circular ring with white on the outside and then darker in the inside. One of the things that you look for is the cecal core here. This one of the signs usually comes together, the cecal cores. In the cecum, you'll see some caseous material in the cecum. Okay, they usually look comes together. We open the cecum, you'll see that caseous material in the cecum. If you do histology, the cecum, you see information of the cecal core. This is the wall. You see all this caseous material inside the cecum. It's quite difficult to appreciate, but you see a lot of necrosis here. Necrosis. And you may want to see the protozoa in the cecum as well. So you have to differentiate it with coccidia. Okay, because all these things. In the liver, I'm sorry, the picture is not so clear, but you can see the liver parenchyma here. It looks the normal one. This one is the necrosis one. Okay, you'll see a lot of inflammatory cells inside here and some necrotic area. If you look under higher magnification, you may see some of the protozoa as well. Yeah, okay. Okay, some of the organism. The diagnosis, usually based on the clinical sign, they have this quite unique clinical signs, but usually based on histology, gross lesion alone, you could have a very pretty much a diagnosis already because they have this unique appearance on the liver. Okay, but if you just want to confirm more, you can send for histology or parasitology to look at the protozoa under the higher magnification. Prevention and control, you can control the earthworm and heterarchis. You control the worms. You basically are controlling the histomonas as well because they require the worm as the intermediate host. By removing the worm, you block the cycles. The medications, you can give dimetridazole or carbazone with some of the options. Okay, there's a few other options you may want to read more on it. Okay, I think that's all for histomoniasis. You probably rarely see it, but if you work with turkeys, you will see it once a while. Okay, about histomoniasis. Spiking mortality syndrome, hypoglycemia, is characterized by low morbidity and abrupt onset of high mortality for 3 days. It occurs concurrent with concurrent hypoglycemia in clinically affected birds. The etiology is usually uncertain, probably infectious. Adenovirus, arenavirus can also cause this. It's quite similar with stunting and runting syndromes. The clinical signs, the chicken will show sign of hypoglycemic. Well, probably in human also we can have hypoglycemia. Head tremors, huddling, trembling, loud chirping or little eating. Some show sign of blindness, ataxia, prostration with leg outstretched, and the severe one, they goes into coma. Recovery often occurs spontaneously. Survivors may develop rickets, runting or stunting, and asacchalitis. So if it happens, one period is like a temporary period. They will recover. The one that die will die. Postmortem lesions is quite non-specific. Occasionally, you will see hemorrhages and necrosis in the liver. the thymus shows some sign of atrophy, dehydration with accumulation of urates in the litter. The diagnosis, typical clinical signs of head tremors, all those like neurological signs, demonstration of hypoglycemia in affected birds. Severely affected birds have blood level of plasma glucose level between 20 to 80 milligram per deciliter. So you may want to take the blood, check the blood glucose level. It's very rarely you measure blood glucose level in chickens, but if you see this kind of signs so high, you may want to do the check the blood glucose level in chicken. Prevention and control, there's no specific treatment. You basically just give them food. Okay, miscellaneous disease. Some of the disease you will see, but it's not so much. Okay, it's not that important. You will see it, but it's not it doesn't raise any concern. It just happens spontaneously. Eversion, prolapse of viaduct. Okay, eversion of viaduct through the vein. Causal factors, a lot of causal factors like hormonal imbalance, worm, heredity, early laying, large eggs, or tooth facts. Mortality usually due to cannibalism. Okay, what happened is sometimes these chickens have very large egg or something. They push the eggs out and then it didn't, and then the uterine become prolapse. So it just came out like this. If you see this in the farm, so there's nothing much you can do also. What I did is, if I'm wearing glove, I just push it back. Although I know it will happen again in the in the future. So you just push it back. Or if it's too severe, what happens is when this thing appears in chickens, okay, it attracts other birds to peck on it. Okay, it attracts other birds to peck on it. So that's how the chicken died. The peck on it, it becomes so severe, the whole intestine came out. The whole intestine came out, then the animal will die. So if you see the intestine is a bit very severe with prolapse avida, usually we just cull the birds. Okay, we just cull the birds. Secondly is egg bound. Causes is usually due to inflammation, obstruction, partial paralysis of muscle or viaduct, and very large eggs. So it's how it. This one is particularly more important in pet birds. I think Prof. Jalila will cover this as well. Okay. Or sometimes if you do postmortem in layer eggs, if you do postmortem in layer eggs, you palpate the abdomen. It's quite hard. Okay, it's quite hard, and if you open it, see few eggs inside it. Usually, it's due to egg binding. So the eggs cannot come out, and then like chicken produce eggs every day, and another eggs come from behind, another egg come behind. In the most severe case, all the eggs breaks. It breaks inside the body and then cause egg peritonitis, cause infection, and then the chicken will die. We also have a lot of egg binding in a lot of pet birds also actually. If you do pet birds, we just do surgery, remove the eggs, or just push it slowly. Yeah, you have to be careful. You don't want to break the eggs. Internal laying is also one of it. Egg falls out of the viaduct into the body cavity. So it's like it reverse. Okay, egg supposed to come out from the outside, and instead something happened. Okay, it goes out again into the infundibulum, into the infundibulum into the body cavity. So it called internal laying, and you end up with a lot of eggs inside the body, and it's not inside the uterus. It's just inside the peritoneal cavity. So where is it? Uterus is not here. Okay, you see a lot of eggs inside the body cavity. Those are internal laying. This is something, yeah. If you were in layer farm, you'll see probably this once a while. Pendulous crop is quite common also. The crop is enlarged. You'll see the content of the crop is foul smelling fluid, lack of muscle tone, and a loss of elasticity of the crop. You'll see this a lot in broiler farm also, actually, broiler farm. And there's nothing much you can do. It's just, okay, they have pendulous crop. Yes, they said it's some theories say it's related to the virus, some said it's related to the overeating, cause the loss of elasticity of the crop. There's nothing much here. There's nothing much of a concern. It's just that it will take some time to empty the crop. Okay, and then when it like the food is in the crop for too long, okay, it sort of become bad, and then the chicken sometimes suffered from candidiasis, fungal growth in the crop. Okay, so you open it, have some gizzard there. It's not the chicken still grow well. The chicken still grow well. It's just the crop is big, and it's not much of it. If you do postmortem, if you sell the chicken also, it doesn't cost anything because you don't sell chicken with the crop, you remove the crop. The chicken, the body will look like normal. Impacted crop is one of the things is not is it's basically the crop is impacted. Okay, but it's not distended like pendulous crop. It's just impacted, caused due to eating of the tough grass or too much fibrous or little eating. Treatment just remove the content surgically or change food. If this one is especially in pet birds. Pet birds. If you have impacted crop, you didn't empty or something, you just stuck there. You just remove it. Okay, do you have any question? This lecture is quite easy. And then not much of important, but yeah, just some other miscellaneous disease that you may encounter. Any question on this? If you don't have any question, what I'm gonna do is we're just gonna go through your test a little bit. Let me see. Okay, if you open your test, Putra Blast, you may see your marks. Attempts. Let's find someone with pretty good score. Hong Yuyan, is it okay? I review yours. 24.54 over 10. So basically you get one wrong. Okay, out of 25 questions. Okay, the first one, bursal tumor is characteristic lesion of Marek disease, lymphoid leukocytes, both A and B or neither A nor B. So of course is characteristic of lymphoid leukocytes. Marek disease doesn't cause really bursal tumor. Semen from infected broiler breeders males play a role in the transmission of which tumor diseases? Avian leukocytes virus. I keep saying this. Marek disease does not have vertical transmission. Only leukocytes virus have vertical transmission. So A. This one is quite easy. The chicken is sitting down on the hog. I did mention in the lecture, and then you can see the spine. Okay, this is the fourth thoracic vertebra. Pinching of the fourth thoracic vertebra is due to spondylolisthesis, kinky back. Okay. The next one is right-sided heart failure. So it's like all the heart is enlarged on the right chambers. Okay. What you see together is usually the ascites. It's like typical right-sided heart failure. It's pulmonary hypertension syndrome. You'll see this also. Spondylolisthesis again is a result from subluxation of the fourth thoracic vertebra. It's just in the nose. This is all straightforward. Should be very easy, right? Which bacterium does not grow on the McConkey agar? Well, not all. Show all question in one page. Okay, this one I did mention in the lecture as well, is the Pastorella maltosida. Although it's a gram-negative, but it doesn't grow in McConkey agar. Cell-associated vaccine of Marek disease should be stored at or in. Okay, this one also I kept saying during the lecture is unique because Marek disease is cell-associated, means like if the cell die, the virus die. So it's one of the vaccine. It's the only vaccine that must be stored in liquid nitrogen. The morphological diagnosis of this condition is you will see the caseous material in the bone. You should see this is the bone marrow, here's the bone structure, this is the leg bone. It's osteomyelitis when you see caseous material. Infection of the bone is osteomyelitis. The causative virus of egg drop syndrome can be isolated in embryonated eggs of. This one also I mentioned in the lecture. The original disease is affecting ducks and geese. So when you want to grow it, you have to grow in ducks and geese eggs. Okay, so it doesn't grow well in chicken and turkey's eggs. So you duck and geese eggs. This one also in the lecture. Which portion of the oviduct is the albumin secreted? Okay, this one is I just want to ask you some of your basic because I did mention in the class you should know the anatomy of the reproductive system and the physiology where the albumin secreted, the shell gland, what is the function of each. Okay, so All of you keep quiet, didn't say anything, so I assume all of you know. So I did ask in the exam. Albumin secreted in the magnum. The area of the hand oviduct where the inner and outer shell membranes are added is the isthmus. Okay, this is again your anatomy question. Okay, you see the keel bone is curved as S shape, and the bird is sitting down. And then they also mentioned the bird most likely 25-week-old layers. 25 week is the peak production of egg. Okay, layers some more. So it's due to calcium deficiency. You can see the fracture of the keel bones and they're sitting down like this. It's osteoporosis. Which neoplastic diseases is highly contagious? Marat disease lah, of course. Okay. Stagnant water most significantly increase the risk of infection with, when you talk about stagnant water, is the breeding area for mosquitoes. So which one is the disease? Which one of the disease are transmitted by mosquito is pox virus? This one is, okay, what will be the diagnosis of this case? You'll see the cartilage in the bones. Accumulation of cartilage in the bone is tibial disc chondroplasia. This is literally, I take this picture from the lecture notes, so you should know. The histology appearance of tracheal mucosa reveals epithelial hyperplasia and hypertrophy and large eosinophilic intracytoplasmic inclusion bodies. The most probable diagnosis is avian pox. Tracheal mucosa, inclusion bodies, intracytoplasmic is avian pox. If intranuclear, it could be infectious laryngotracheitis, but this is intracytoplasmic, so it's avian pox. Pneumococcal mutants causes scaly leg lesion on the leg. Scaly lesions on the leg. This one is also under the skin diseases. Is as pictures there. Displacement of the gastrocnemius tendon is not associated with associated with rotation of the tibia. This one also in the lecture notes. Rigid extension of the leg at the right angle. Okay, it's again rotation of the tibia. Rodents play an important role in the epizootiology of, I did mention in the lecture. So one of the way to control Pasturella maltosida, fall cholera, is to prevent entrance of rodents, cat, dogs, all these things, because when they enter the farm, they carry this bacteria, but they themselves do not show any signs. So cat and dog, they look fine or something, but actually they can carry this bacteria. If you have all these rodents, cat, dogs, or any other animals in the farm, you predispose yourself into fall cholera. The cause of deep pectoral myopathy, green muscle disease, is reduction of blood supply secondary to swelling of supracoracoid muscle. It's, like I said, is due to overflapping of the wing. Which bone disorder is characterized by a plaque of cartilage that extends from the growth plate in the metaphysis of the proximal end of tibiotarsus, tibial disc chondroplasia. You see this plaque of cartilage. Same as the picture just now. The appearance of the egg above will arouse suspicion of what infection? Okay, this one you have to refer back to your lecture notes of the eggs, affect egg quality. And at the end, there's one unique appearance of this egg where they only affect the apex of the eggs. So it's due to Mycoplasma synovial infection. Which is the most noticeable and consistent gross lesion in the hearts of chicken affected with pulmonary hypertension syndrome? Dilatation hypertrophy of the right ventricle is the same as the previous picture. Okay, it's actually all this picture is like, all this question is like repetitive. Which lesion is characteristic of Newcastle disease in chickens? Okay, hemorrhages and necrosis of GALT. What is the most prominent gross lesion in sagittal section of the proximal tibiotarsus of 3-week-old broiler chickens fed a diet deficient of calcium or vitamin D3, widening of the apophyseal growth plates? Deep pectoral myopathy, again, deep pectoral myopathy is caused by muscle swelling followed by ischemia. It's just a repeated question. Spondylolisthesis again. Pre-thoracic vertebra. So you have like three marks already. A flock of 34 weeks old layer is experiencing tumor. Immunocharacterization of the shows tumor cells are CD4 positive MAC, which the following disease is correct. First of all, the MAC is the oncogene of Marat disease. I did mention in the notes. Okay. CD4 positive. Okay. T cells. 34 weeks old, a bit old, but it can happen in Marek disease. So this is a Marek disease problem. Many birds in a flock of 2 weeks old chicks sit on their hot joints and is inclined to walk on with stilted gaits. For it's 2 weeks old. Other birds are recumbent with the chest leg extended. Well, before examining what would be the first disease. First of all, it's a 2 weeks old, very young bird with bone problem. The first one should be rickets. Okay, this one should be rickets. The condition eggshell apex abnormalities again is the same as the picture just now. Is Mycoplasma synoviae. Except that one is a picture, this one is a text. So if you can answer that one, you can answer this one. Rotation of tibial tarsus result from the rotation of which part of the bone? Neither A nor B. Okay, it's not the tibial tarsus. Okay, this one. Based on the gross microscopic lesion, the most likely diagnosis for this case is, see the liver is yellow like this, and you see the inclusion bodies here of the liver. This one is exactly a picture from the lecture notes. Okay, this inclusion body hepatitis. Semen from broider breeder males play a role in transmission of it. It's just a repeat question again. Avian leukosis virus. Did I give 2 questions of the same thing? Enlargement of the rib at the junction with vertebrae may be seen in chickens and turkeys affected with rickets. Microscopic examination of wet smears of intestinal content of birds affected with coccidiosis may reveal oocysts. Each oocyst content, this is quite a tricky question. First of all, wet smear of intestinal content. So they haven't sporulate yet. So you will not see any of these sporozoites. Okay, they have different stages in the intestine, the merozoite, all those things in the intestine. So it's none of the above. None of the above. It's a wet smear of the intestinal content. If you take from the feces, then you will see the sporosis and sporozoites. This one is deep pectoral myopathy or green muscle disease. Is exact same picture from the lecture notes. Which bacterium stains bipolar and gram stain? This one also is easy. Pastorella montosida. A backyard chicken was presented to a veterinary diagnostic laboratory because of yellow-white lesions in the comb and wattles. The lesions are separated off easily, leaving an open erythematous surface. Based on the gross lesion, what is the presumptive diagnosis? Is a rare disease caused by favors. Show you a picture before. Under the skin disease. Developing egg spend the longest time. Again, this one is just your basic knowledge. Shell gland. 41, rubbery bones, rickets. 42, cause of osteopetrosis, retrovirus. ALV can cause one of the rare manifestation of retrovirus is osteopetrosis. Hemorrhages at the gastrocnemius tendon, rupture of gastrocnemius tendon. Could be to one of the due to reovirus. Which bacterium typically causes localized subcutaneous infection and occasionally septicemia in humans following entry? So erythropoietic rustiopathiae is a zoonotic disease. This one on the zoonotic disease can cause swollen cuts. That's why I keep saying in the lecture, you must wear glove when do postmortem of turkeys. Definition of valgus deformity is outward angulation of the distal end of the tibial tarsus. Osteoporosis in laying hens can be defined as decreased amount of fully mineralized bone structure. This one is osteopetrosis. The shaft become big. I think it's the same picture in the lecture notes. Retrovirus infection. This is where most people got wrong, even Yuyan here. What's wrong with this picture? Okay. In the image we were taken of a farm, the farm is based on what disease? It's the same question as previous one. Okay, like I said, if you allow cats, dogs, rodents in the farm, you predispose your farm into with fall cholera. So the answer, if you put fall cholera or Pastorella montosida, it will be right. So this is where everybody got wrong. I don't know if anybody got it right on this one. I haven't checked one by one yet. Which of the following coccidiosis? Coccidiostat is not an ionophore. Nicarbazine. All have sin, all those things. Baginabazine is not. A flock of 18 weeks old Leghorn pullet experience increased mortality, histopathy, fibrohydrophilic, torticollis, cranial bones. Oh, this one is like fall cholera, falling of the infraorbital sinus. This one is the scaly leg, cranioidocopters mutans. This one is easy lah. I think all of you should got it right. It's literally from the lecture note. Just drag and drop only. Ocular myriad disease most often affects the iris and the optic nerve. It affects the nerve and the iris. Okay, that's all. You can check your marks. I'm gonna close it after this. If you have any issue or you think I made it wrong decision or anything, something, please message me. Okay, any question? Okay, feel free to check your marks because in few minutes I will close it again. Finish a review. Based on the total score, it looks like everybody doing it well. I mean, almost everyone is like getting A. So, okay, like more than 50% got A on the test, test two. So it should be easy. Okay, good job. That's all for today. Do you have any question before I ended this session? Okay, if there is none, I think that's all for today. I hope you have a good weekend. You have a good weekend. Keep safe. Have a good weekend, everyone. Okay, see you.